Now let's talk a little bit about medical terminology for respiratory care. The main thing with medical terminology is that we all need to be speaking the same language. This allows for effective communication, so you know what I'm saying, I know what you're saying, the doctor knows what we're saying. Okay? Now, some terms we're going to cover are unique to respiratory, and that's part of why we do this during Respiratory 100. You're going to be learning a lot more than this. And in this week's reading, it says to read the glossary because you're going to know all of those words by the time that you graduate, so you might as well start learning them now. And some terms we've already covered in previous videos of who is whom in the hospital. So a resident versus an intern versus a fellow versus an attending. So we'll start off with talking about some other terms that you're going to hear tossed around. The first one is emesis. Emesis is a term for vomiting. So when someone is throwing up, we call it emesis. Now sometimes they may have what we call coffee ground emesis. It looks like they're throwing up coffee grounds. This is usually limited to the presence of coagulated blood. And it can range in color from very dark red to black. It depends on the age of the blood that they're throwing up. And it usually indicates that there's some type of bleeding in the upper GI tract. So the stomach or the beginning of the small intestine, the duodenum. A fistula is a connection between two things that shouldn't be connected. One that we tend to see and talk about is a TE fistula. That stands for tracheoesophageal fistula. That means there is a communicating hole between the trachea and the esophagus. So that means gastric content, acid, things like that can get into the lung and cause burning through that connecting tube, which we call fistula. Febrile is a word that we use to talk about someone who has a fever. So if someone is febrile, that means they have a temperature above their normal body temperature. Remember, in general terminology, we use a to mean without. So someone who is afebrile means they do not have a fever. The next term we're going to talk about is ictal. Ictal is a period of a seizure. So you will sometimes hear people talk about a pre-ictal episode, a mid-ictal episode, or a post-ictal episode. Decorticate versus decerebrate. These are posturings. And the main difference between the two is whether or not the arms are bent at the elbow. A person whose elbows bend and they fold their arms up towards their chest has a decorticate posturing. A person whose limbs are extended the whole way out from their head has a decerebrate posturing. Expectorant. Expectorant means some type of medication that helps to remove phlegm by thinning and loosening it. Now, person who expectorates is someone who is coughing something up. Another term you're going to hear is obtunded. Patients who are obtunded have a dull or reduced level of consciousness. So they come in and they're a little hard to arouse, and they are just kind of not with it. We call those patients obtunded, and that is a bad sign for a vital sign for a patient. Not to be confused with lethargic. Lethargic patients are awake, they're just a little slow to answer, they kind of usually have their eyes open. Laceration is a term that we use for any type of cut. Abrasions usually are superficial on the skin. There may or may not be blood present. A contusion is a bruise. So someone who has contusions has bruises. And you may not always be able to see a contusion. Lungs can get contusions. We can't see that, but we can determine it through scans, through other vital signs. And necrosis. Necrosis means dead tissue. And that tissue is usually spreading. You will hear them talk sometimes and say the word necrotic tissue. But that means it is dead tissue that is basically starting to rot. Now, there are some terms that are specific to respiratory terms, and the language of respiratory can be very confusing. So you have to be able to identify the meaning of various symbols as they relate to healthcare and to respiratory therapy. You'll be using these throughout the rest of your career, so you might as well learn them now. The ones that we're going to cover in this class are ones that I'm not reteaching. So as we move forward in the program, you will be expected to know these symbols and meanings. We start off with the capital letter A. Now, when you see the capital letter A, it means alveolar. A lowercase a means arterial. So it does matter whether you're using a capital or a lowercase letter because it can mean two different things. A capital C stands for compliance. We talk about the compliance of a lung, how easily it moves. Whereas a lowercase c stands for capillary. So sometimes if we're drawing blood, if it's an arterial blood, it'll have a lowercase a. If it's capillary blood, it will have a lowercase c. Now we get into the fun part. There are three terms, actually close to four, that all start with capital D's. So you have to learn what the context is in which we're speaking to kind of have an idea of which capital D we're discussing. The first one is dead space. Dead space is where gas does not take place or does not exchange oxygen and carbon dioxide through the lungs. Diffusion is the movement of gas from an area of high pressure to low pressure. and delivery. So delivery means how are we giving whatever. If it's medication, if it's oxygen, if it's fluids, that's what the delivery means. Now, sometimes you will see a letter that has a little dot over it. And that little dot changes the meaning of the symbol. Usually, the dot means minute or flow. So here, a capital D with a dot means minute delivery. How much are we delivering of whatever we were talking about in 1 minute? Now, a capital E or a lowercase e stands for expiratory. How much are we exhaling? Capital E alone can also mean elastance. Lowercase f means frequency, how often something is happening. Usually the lowercase f is used for respiratory rate, or we call it frequency. Capital F stands for fraction. And we'll learn about this more when we talk about FiO2, fraction of inspired oxygen. It is usually a decimal point. And then capital P. Capital P usually stands for pressure. Now, in the next video, we're going to continue. As you can see, we're going alphabetically. So we're going to continue with talking about some of these terms.